name is Prabasan, and I've undergone a procedure at Healing Hands where I was here for 6 months, and I was currently suffering with a complex fistula for the past 4 years, and I finally healed. I just like to thank Dr. Porwal for his warmth, kindness and generosity. He's the perfect example of a surgeon, something that's a rare commodity and you never get anywhere in the world anymore. And he's not only a genius in operating theatre, but very, very, very perfect example of a surgeon.
Thank you so much.
Yes, you're welcome. So how I found Healing Hands was basically I don't have Facebook, so I started searching for, when I had 6 previous surgeries in South Africa and none of them were working, so I started searching for an alternate solution. Something maybe I was reading along the lines of laser and those type of things. So then I came across a YouTube video explaining DLPL, and then I saw it was a 99% success rate, and I said, I mean, no way in the world has a 99% success rate. It's like 60% throughout the world. So at first it was a little bit difficult to believe, but then I started reading some of the transcripts, some of the documents that's being published in India, and then it made me realize why it is a 99% success rate. Not only because of the technique, but I mean, one of the most important things is the aftercare at Healing Hands. Because you're constantly going through evaluations on how your healing journey is going, at some point you have to heal, because an evaluation is to evaluate the internal process, it's to shave scar tissue, it's to see how many percent you have healed internally, it's to do deep cleanings. So I mean, yeah, I'm really grateful, and it's been like, I mean, as soon as I found that, I messaged Dr. Paul on LinkedIn, and for someone that's really busy and his operation is going like doing 25 surgeries a day, it was really amazing how quickly he responded to me. I got a message back within an hour, and I had Dr. Snell's details. Dr. Snell has given me all the information I needed. I asked a lot of questions, and even when I wanted to consult with how the process actually went, she explained it to me. She had doctors to chat to me if I needed, and anything that made me feel really comfortable to be here. Yeah. And another good benefit of Healing Hand is you always have 24/7 doctors available to you, all quality doctors that you can come to at any time, even if you have the smallest concern. I mean, that's great. You have clinics every 2 days, which makes you feel comfortable. So if there's anything that could go wrong, it will be picked up immediately, instead of having clinics like every 10 days or a week where you miss things and then everything can flare up again. I think I've been, for all my surgeries, these are the best supporting doctors that I've ever came across. They're all very similar to Dr. Porwal, very kind, caring, compassionate, and they're there to help you and answer any questions you have. The important thing is you have all of these doctors' details and contact numbers, so whenever you need to chat to them, you can chat to them, and they'll respond immediately. So it's not a concern at all. Whatever you have will be dealt with immediately. Yeah, so my inspiration to come here was basically I spoke to a patient by the name of Nicole. She gave me all the information that I needed and helped me and gave me the confidence to be here, made me feel very comfortable. Also Dr. Snell by answering all of my questions, being so patient with me with how many questions I did ask, and yeah, I'm really grateful. And happy to go home, happy to see my family, who's also been a really good support for me, and at the same time also a bit sad because I've been here for a while. Pune has become like a second home. Healing Hands treats you as a second family, so thank you for everything that you have done for me.
Thank you, Austin. In fact, it has been a good journey having you with us, and your faith and positivity has actually helped us a lot, and it actually improved our confidence in your journey of being free from fistula. I distinctly remember when I saw you for the first time, your reports and everything, and the clinical diagnosis that I had. It had a mention of, say, grade 4 disease. But when I actually took you for the surgery, and when I realized that your entire sphincter complex is involved, so we call it as extra sphincteric disease, wherein the sphincter is 100% involved. So it was one of the most challenging case for me as well, and there was circumferential disease. Technically we call it as bilateral supralevator extra sphincteric fissura, and to add to that there was a branch which was going to the tailbone. So it was one of its kinds, and when I went through your past record, it had mention of multiple surgeries. You had plugs in past, you had open fissulectomy in past. Now when you undergo multiple surgeries, your sphincter muscles become weak and there's a greater risk for damage to sphincter muscles. So that was our biggest challenge, to save the sphincter complex. And that is why we were very watchful, very careful while treating you throughout this course, because we wanted to preserve the sphincter muscles. And I also realized that when I consulted you for the first time, I realized that you have kind of a history of constipation, and you were kind of addicted to movie call.
That was one of my greatest concerns, because when I came here, like after reading the transcripts and knowing that because of the internal evaluations at some points I will definitely heal, one of my greatest concerns was I had a chemical dependency to Movicol. So I didn't just take one Movicol a day, I had to take 2 Movicols a day, and if I missed it, then I actually had a problem going to the toilet. And like when I came here, my concern was, even if I healed from a fistula, would I ever get over the constipation, because it happened for like about 2 to 3 years. And then as soon as I came here, you made me feel so comfortable that you told me no matter what, everything will be sorted out. And I mean, it was really amazing. The medication here is unbelievable. Everything is natural from a plant-based source or so forth. And then you gave me gut bio, kiwi biotic, and Constat, and you put me on a diet for the first 2 weeks. Within 4 days, I never needed Constat again. I was fully free from constipation, and really, it was really amazing. Thank you for that.
Whenever I have to treat a case of complex fistula, I have to understand the entire journey of the patient as a whole, because for me it's not fistula, but it's the entire quality of life. So the purpose is that you should be free from fistula, but at the same time your quality of life should improve. So when I saw your history, I wanted you to be free from constipation as well, and that is why we took immediate action on that front, and we started with combination of plant-based laxatives, prebiotics, probiotics, and that really helped, and I'm happy to know that. Another aspect which I advise, which we look into when the patient is recovering from a complex fistula is exercise. So we advise all our patients to start exercise. We want them to physically active, because fistula actually drains you internally. It also leads to kind of anxiety, depression, and which significantly affects the quality of life. And when you start exercising, it leads to release of endorphins, which gives you a lot of positivity, and in a way it helps my procedure DLPL as well, because we want the muscles to be active, we want them to squeeze the pathology out. So initially first 4 to 6 weeks you might have heavy drainage because the pathology is being squeezed out in the recovery period. So we never advise rest to any of our patients.
Yes.
And you are an example, and you've been physically active since the time, maybe after 2 weeks of the surgery. So I was very happy about that. Yeah, second day. Great.
Another important point that I forgot to mention, that when I came here, during the first 5 minutes in Dr. Porwal's room, the scope that he has done for me has told me more than what I knew in 4 years. I mean, we found 2 internal openings, it wasn't just one, and I was only being treated for 1 internal opening. We had 2 internal openings with multiple branches. I mean, With the laser technique in DLPL, it also shrinks the tract as well as any small abscesses that could be around the area. So that really helps a lot as well. Thank you.
Yeah.
Once again, anyone who's thinking to come to Healing Hands, I hope you definitely made the decision. It shouldn't actually be a decision. If you ever want to be fistula free, this is the place to be. I mean, the worst of the worst cases come here, the most complex. People have undergone, I know one patient has undergone 21 surgeries prior to coming here and finally being cured of a fistula. I've been here, I had 6 prior surgeries. Most of the people have been here for more than 4. And it's the only place that I know that you will definitely get cured. So as I said, I hope this video inspires people and you do make the decision to come to Healing Hands.
Thank you.
Thank you.